Okay, first the GIT is the entire work of the parasympathetic nervous system. So when we think of the food, think of the food, gastric secretion is occur. Okay, so let's say this is the stomach, pylorus part. Then this is the first part of the duodenum, second part of the duodenum, sphincter of Brody, third part, and jejunum, ileum, all like this. And this is a major colon, and this let's say this is a rectum. Okay. Imaginary. Say this is the gallbladder. Common hepatic duct, common bile duct, cystic duct, GB, pancreatic duct, and this is the sphincter of the Brody. Okay. So first of all, let's say this is the food. Food is rich in protein. So we can, once the food is come, we have a parasympathetic nervous system. First thing is inhibit T cell. So there is a decrease in somatostatins, so there is no inhibition. Then it stimulate the chief cell, which is basophilic. So I am drawing it in blue. Chip cell. What chip cell do? It is secrete pepsinogen, and it is the inactive form. To get activated pepsin, we required HCl, which is gastric acid, and which is come from this eosinophilic cytoplasmic parietal cell. Parietal cell produce intrinsic factor and HCl. And the pepsin is work on protein digestion. So first question in your mind is how HCl is get formed inside parietal cell, and the second question is how or what molecule which increase the HCl and decrease the HCl. Okay, so first of all we talk about, let's say this is the parietal cell. So inside the cell, normally what's happened inside the cell, we have water and CO2. They are both are combined with make the bicarbonate. Then bicarbonate is get dissolved, make H plus and HCO3 minus. So at the we have this is let's say it is a blood vessel. So this bicarbonate will exchange with chloride by the help of the chloride bicarbonate exchanger. Okay, then this the H plus, it is get exchanged by, this is the lumen of the stomach, exchanged by potassium. So this H plus is come, and we have here is a chloride channel. Chloride will directly goes, and this chloride they both have make the HCl. Okay, this is how it happen. And so we make one fact that one HCl molecule secrete bicarbonate into blood. So we have a that is called as a postprandial alkaline tide. Okay, this phenomena is called a post-alkaline tide. Then we have some applied this block H plus pump, which is a H plus K plus ATPase pump is inhibited by proton pump inhibitor like omeprazole or something like that. Okay, omeprazole or something like that. And PPI is drug of choice for all ulcer. If the peptic ulcer is formed by PPI, then we use prostaglandin analogs with like misoprostol, which is increase the PG will decrease the HCl secretion. The our first question was the how HCl is get formed inside the parietal cell, and we done it. And the second one is how is this GIF cell this parasympathetic nervous system is also stimulate the parasympathetic nervous system also stimulate enterochromaffin cell. Okay, enterochromaffin cell, GIF cell, enterochromaffin cell, which is G cell which secrete the gastrin will directly stimulate the parietal cell or indirectly via the activating ECL neuroendocrine cell, ECL enterochromaffin cell, which is the histamine which stimulate the parietal cell. And histamine is the most potent HCl secretion stimulator. So once the stomach pH is cross below the 1.5 pH, there is a negative feedback and there is inhibition of the HCl secretion by I cell or this H. pylorus. This pyloric part, when there is a food is come inside the duodenum, the first thing is the food is coming from the stomach, which is acidic. Once and the duodenum cell wall is not suitable for the acidic environment, which may be a damage to the duodenum. So we required bicarbonate to neutralized gastric content, and we have to also decrease the gastric emptying. This is the thing is done by secreting. This thing is done by the secretin. This thing is done by secretin. Now secretin, and now we required we have a ICCK cell cholecystokinin, which is stimulate the gallbladder, contraction of the gallbladder. Gall is come. Here is a gall is come. Then it is increase the pancreatic hormone is come, release the filter, and it is give the pancreatic hormone by secretion flex the body sphincter so that the secretion is coming into place. So why here is the thing why I talked about first secreting, and then why I talk about ICK, because the once is food is come into a duodenum, and which is the gastric content is acidic, so it is stimulate the gastric duodenum wall. This is stimulate the duodenum wall. You have a secreting. What secreting is first of all, secreting is inhibit the neuroendocrine cell, it's a G cell, and decrease the gastrin secretion, and food is coming, so we don't want the acidic food in the duodenum. So what happens, the secretin will decrease the gastric emptying, because we don't want the food. And first of all, whatever is the food is come, we have to neutralize by the bicarbonate HCO3. It is done by the secretin, and the bicarbonate is required for the two things. It is to neutralize the gastric acidic content, plus to work. So the alkaline medium is work, and the pepsin, the pancreatic enzyme should work on the duodenum and digest the lipid and carbohydrates. And ICCK will till the duodenum everything is finished. First of all, majority of the digestion, secretion, absorption is occurring in the duodenum and the stomach itself. The stomach is responsible for the protein digestion, and once the protein get digested, it's coming to duodenum, and duodenum is required for the lipase, required for the lipid and carbohydrate metabolism. Once it's done, it get absorbed in once it's get done, it is further absorbed in the jejunum, and then it is ileum. And the thing is how this food is get move forward, how food get forward. So it is done. It is let's say this is the food content. Here we require the contraction to push forward, and here we require the dilatation to accept the food, and this is the called as a peristalsis. This is called peristalsis. And contraction is followed by the acetylcholine, and the substance, and the dilatation is done by the nitric oxide and the VIP. So nitric oxide is a lower esophageal sphincter. Relaxation. Nitric oxide is required for the relaxation of the lower esophageal sphincter. If not, it is caused the achalasia cardia. And if the VIP is increased too much, it causes increase the water and the intestine secretion, and it is increase the peristalsis, will cause the non-alpha, non-beta pancreatic cancer, which is called watery diarrhea, hypokalemia, and achlorhydria. And this is the thing. And now the last thing I want to talk about I wanted to talk about what is the motilin. Many of these heard we also have a motilin receptor. It is a MMC and is a fasting. It stimulates everything like washing of the stomach, duodenum, small intestine, large intestine, everything. MMC. It is a motor migratory complex. It is occurring 5 times every minute. Motilin is also stimulated by the macrolides, which are erythromycin. Thank you.